Hello and welcome to the Derm Dispatch for Dermatology Times. I am Renata Block. Today, I have the great pleasure of interviewing Jessica DeLuise. She is a PA and a certified culinary medicine specialist. Not only that, she is an Emmy Award-winning host and on-air talent on QVC. And finally, she's on the advisory board as a chair at the American College of Culinary Medicine. Today, we are going to be talking about how nutrition impacts dermatological disease. Jessica, thank you so much for joining me on Derm Dispatch.
I'm looking forward to this conversation, Renata. Thank you for having me.
So, as a PA, we love to learn and we love to explore. And one thing that caught my eye about you is culinary medicine. You got the certification. What drove you down that path?
I think a lot of us have defining moments in our life that really push us toward a career path. And for me, it was when I was 16, 17 years old, and I began to have these syncopal episodes. And ultimately was diagnosed with primary amenorrhea, PCOS. I had reflux with ulcers, and then I was passing out because of potentially a complex migraine or partial seizure disorder, which I've since grown out of. But through that evaluation, I met some incredible practitioners, including the gynecologist that was a physician assistant, who was one of those first people who made me feel heard. And from a patient perspective, that is so important. So it gave me the idea to become a PA myself. And that is why I ultimately went to PA school. And through my challenges with reflux, and then, of course, this syncopal episodes, I really had to take an evaluation of my dietary intake, my lifestyle. And so, food from a clinical perspective became really important. And it was tied to how I felt. And so when I learned about the culinary medicine certification, I was like, no brainer, of course, for sure. And I loved learning. I loved that program. I loved learning in that program. And now sit on the advisory board for the American College of Culinary Medicine, as well as a few committees at the college. So that's really important and special to me. And I also completed a AAPA PA Foundation fellowship, which was really super interesting, and currently getting a doctorate at the College of Idaho in lifestyle medicine. So definitely a forever student. And I think that's important. As PAs, we have the opportunity to keep learning and to do better for ourselves and our patients. And so I really put a lot of value in that.
I think that's so important, and especially the nutritional aspect of overall health.
Hmm.
And again, we're going to talk a little bit more about that in a bit, but like metabolic syndrome and really what nutrition intake impact has on exacerbating eczema, atopic
Hmm.
dermatitis, or psoriasis, or other skin conditions. So I think it's so important as a PA to understand the value of what our nutritional intake has on our bodies.
All subspecialties really can use nutrition information to
Absolutely.
in their patient care plans.
I think it's important to recognize it. And I think that's what you are bringing to the table, no pun intended, is recognizing the importance that we play for that patient in regards to that nutritional intake. Recognizing that nutrition plays a role in our health is a definite conversation that we should have with our patients. So, all of this passion led you to create an Emmy Award-winning show. Can you tell us a little bit more about that?
Hmm. I never set a career goal to be in the media. Let's just start there. That was something that happened by accident. Of course, I worked really hard at it, but originally what my career path was I had took an interest in nutrition, and I worked in internal medicine at the time, and seeing that nutrition really affected my discharge patients. So when
Mm.
I would discharge them, I would work with case management to get them resources for food because maybe they didn't have the dexterity to prepare food on their own. And so I started making these little snack bites and selling them at a local farmers market. But what really brought people over to my table and engaged with me is that I would do these demonstrations. So, like foods with vitamin C, protein, education. And you would be surprised, but people really loved it. So, they would come over, they'd ask questions, and that would give me some inspiration for the following week. Through that experience, I was asked to speak with a Girl Scout troop to help them get their health and wellness badge. So, a colleague of mine at the time, who was a physical therapist, came with me and we presented to this Girl Scout troop. And we were really able to talk about exercise and stretching and food really positively to this young community of girls. So, from there, I was like, well, this is pretty cool. I like doing this. So, I started to pitch out to the media. I lived right outside Philadelphia, and I started to just email producers and pitch segments and podcasts. Anyone that would have me, I did it. I was yes, yes, yes. And so that's really what prompted my career path is that Girl Scout troop presentation. And then ultimately I auditioned and am now one of the on-air experts for QVC. I contribute to the news all around the country, and I was just hired as the food and wellness contributor for Scripps News, which is a national news opportunity. And it's really such a great way to deliver practical recipes and information, real-time news education to the masses. And I think that's what's really important is access,
Yeah.
access to this information and getting people these tools or even ideas that they can bring back to their practitioners and talk about.
I couldn't agree more. And I love the access aspect from somebody who is going to provide the right information. There's so much noise on the internet today, and having a resource, someone like you, I think is a win for the public because you are able to spread that message nationally and really combat some of the myths out there that are happening in regards to not only skincare on my end, but nutrition on yours. So thank you for
Mhm.
doing that. And
Thank you.
what an amazing journey. Congratulations on that Emmy.
Thank you. Yeah, that was a funny story. I actually, so I don't know if a lot of people know this, but when you produce a piece of content or media, you actually submit yourself for an Emmy. People don't just
Okay.
happen upon your show. I mean, sometimes they do, of course, but yeah, you submit yourself. And so I did that out of, a recommendation from my production team, and I heard nothing. And now we're going back to 2020, 2021 when the show aired. And so I remember working in urgent care, and I was in an exam room doing telemedicine because we weren't seeing patients in real life at the time. And so I was sitting there and I got this weird message, and I was like, this has to be spam. And it was from a hospital in my area. And they said, hey, Jess, we got your Emmy Award here. Let me know a forwarding address. And I was like, wait a second. What do you mean? Who got what? Huh? And I looked up the person, I looked up the healthcare system, and I was like, okay, this person is a real person. I looked at their email address. And then I went to the Emmy website, and there it was, my name, and I had won in my category, but there was no award ceremony because it was in the middle of the pandemic. So
Right.
how was I to know? And so I went out, I brought my laptop out, and I asked the MA and I asked the clinical administrator, I said, read that name. Is that my name right there? Because it was incredulous. And
Yeah.
so they read it, and I did win. And so I responded to that other healthcare system that gotten my award by accident with a forwarding address. And yeah, that's it. It's right there.
Yeah,
But
I
yeah,
love
that's how
it.
I found out that I won.
You know what? I mean, the reason I have you here today is because your background, like in internal medicine and urgent care, you're you're the front line to those referrals to the derm clinic. And when you see severe diseases, and I'm gonna bring in hidradenitis suppurativa, that is one that we see a lot going to urgent care and continuing to get those lesions lanced and really just not being referred to the right person.
Mhm.
And something with hidradenitis suppurativa, you really have to start treatment early because once they get to that early stage 3, not only pain, but treatment options are just very, very difficult for that patient. So again, I think more information is coming out of how it's a multifactorial disease, and nutrition definitely has a role in that impact. Can you share a little bit about that?
Yeah, and I think you make a really good point. So I mentioned earlier, no matter your subspecialty, nutrition and lifestyle play a role. You're going to see
Yep.
patients with HS. You're going to see patients with acanthosis nigrans. It's important for us in the urgent care to recognize those symptoms,
Yes.
make the proper referral. And one of the things that we've been really successful in doing is collaborating with our subspecialties in the area. And so we have these informal connections between practitioners, and we can share with the dermatologists because sometimes they're unaware. How are patients presenting to the urgent care?
Right.
What are they seeking? What is their history like? And then they can present to us what is important to start immediately. How quickly do they want to get in? Can we have a direct line of access to their office to get patients
Absolutely.
in quickly? So I think that that's been really successful for us is understanding the role of each subspecialty,
Mhm.
but also recognizing some of those symptoms. For me, in urgent care, when I see somebody with maybe hyperpigmentation on their back, right, acanthosis nigrans, it's a opportunity for me to say, hey, when was the last time you were at your primary care or got your lipids checked, or hey, you're here for X, maybe we can throw some grab some labs while you're here. So while I'm not spending an inordinate amount of time because it's not really my role then, and I don't have the time in urgent care to spend with patients like that just because of the volume, but at least I can give them a little bit of guidance. I can recognize those signs and symptoms and give them some a path forward and
Right.
add it to their treatment plan in black and white. Here's what I need you to do to follow up for your overall health.
Right. I think collaboration is, gosh, something that we should bring on the forefront. And we do to a point, obviously, but I think it's more important now than ever, just because I think patients can get their own information and start Googling
Hmm.
or going to Chat GPT and perhaps going down the wrong pathway
Hmm.
that can cause potential harm. But something that I love that you're doing in your community is reaching out to those subspecialties within the community. And
Hmm.
I would love to see that kind of nationwide because we're all busy and we're all booked. Getting
Yeah.
into a derm clinic can take months for a patient. That can lead to frustration and then them giving up altogether on that. But if we have a communication line within the area where those people can get a direct appointment, we have cancellations, we can squeeze
Yeah.
someone in and just get them established to
Hmm.
start that care. I think it should be done nationwide.
Yeah. Yeah. And it doesn't stop with derm. I mean, our
Right.
cardiologists, our gynecologists, even our ophthalmologist, even to pick up the phone to know who's on call, to make sure they're sharing that on-call schedule with whomever is covering the weekends in the practice for that specialty and say, hey, I have a patient here who looks like this. What would you suggest I do? And then maybe they can wait that extra week to get in with the
Right.
specialists because we have at least given them the proper treatment. So I think that's huge. And I think it's really important. It's hard. It's hard to get a hold of people and you're kind of tracking people down. But once you do, boy, your patient care is just up a degree for sure.
Yeah. I couldn't agree with you more. All right, so let's bring it to skin diseases.
Mhm.
How do you feel nutrition plays an important role in dermatological conditions? And more importantly, should patients rely on supplementation?
Good question. I do think that dietary intake is definitely linked to some skin disorders. Of
Mhm.
course, there are predispositions, there are genetic contributions to skin disease,
Absolutely.
right? But 100% diet does play a role. And so you asked about supplementation. When we see a patient on a myriad of supplements, often they're doing it for a specific intention. So I think it's an opportunity for us as physician assistants to ask our patients, all right, you're on this specific supplement. Why are you taking this?
Mhm.
Rather than immediately discrediting them, maybe they're going to tell you, like, well, I've been getting dark circles under my eyes, or I have this rash, or I'm having blemishes here on my chin. And so we're like, okay, maybe it's not the supplement that they're taking. Maybe there's something deeper that we need to dig for. And so I love patients. When patients come in and they've printed out the information and they're on these supplements and they're asking questions. I know a lot of my colleagues find that a little bit challenging, but those patients that are invested in their health, I think those are the best patients. And you
Mhm.
can have a really meaningful action-focused conversation with those patients. So for me, it's why. And we know there's not a lot of safety data for these supplements. We
Right.
don't know what the additives are, where they're coming from, if exactly what they say, what the label says is in that supplement is actually in the
Right.
supplement. So I think there's definitely some caution that we need to take with supplementation. But if we can ask patients why, maybe they're fatigued, right? And they're getting bruises and they're here at the derm office and they're tired. Maybe they have iron deficiency anemia that no one's ever diagnosed. So if we ask, why are you taking these supplements? We can sometimes uncover some deeper pathology.
I agree. And sometimes they don't even know why they're taking it. Maybe, their friend is taking it and the friend is feeling better with it because
Mhm.
maybe they have a deficiency and the patient coming in doesn't have a deficiency and they want to feel better. So I think, having that educational piece of the importance of supplements and especially the more popular ones, but you're right, not all of them are created equal.
Mhm.
And that's the scary part about them because we don't know what that patient is taking. We don't know the brand or the source where it's sourced from and how we can rely on that. But having a list of recommended supplements is something I have in my practice. And I think it helps guide the patient to choose the correct supplement. But we
Mhm.
have blood tests that we can check for iron levels and vitamin B12 and all of that. So I think the why is so important and it shouldn't be dismissed. And it's also something that I think we should ask because a lot of patients don't
Yeah.
consider that as a medication that they have to report. And I think we just have to remind ourselves, are you taking any medication that includes supplements or any kind of herbs? Because then it's kind of like, oh yes, oh yeah, I didn't think about that. I am
Mhm.
taking this
Mm.
and this is the why.
Yeah, I think that's a great point. And I love what you said about patient educational materials. I mean, there are a ton of free resources online to curate those lists for patients. So as you are recommending things and typing them out for your discharge paperwork, throw it on a PDF and start to compile that information. And then it's easy to hand it out to patients and they have something tangible to
Right.
like slap on their refrigerator. So I love that. I love that tip.
So one thing that I want to bring up with you is gut dysbiosis. There's not like a technical diagnosis for that, but it's a really hot topic all over, right? Internet and even in our medical journals. I want to talk about pre and probiotics and the importance of them in just overall health. We're finding that some probiotic strains are helping with atopic dermatitis. We're also finding that taking pre and probiotics during pregnancy can reduce the risk of your child developing atopic dermatitis. I want to get your input and a little bit of explanation between the two and what
Sure.
your thoughts are about them.
Probiotics are those live organisms, and prebiotics are essentially the food for the probiotics. So, probiotic rich foods are things like our fermented foods, fermented pickles, kimchi, sauerkraut, yogurt, kefir. Our prebiotics are things like soluble fiber and a really inexpensive, ubiquitous, easy to use prebiotic fiber is beta glucan from oats. It's also in barley, but oats are just, you can find them at any grocery store, dollar store, and they're so versatile. They're shelf stable, they live in your pantry, so you can process those. It's a flour and a baked item, bread chicken, or just make a lovely, get some frozen fruit, some berries, and make a lovely oatmeal breakfast. So that's a really easy and cost-effective way to get prebiotics in. Maybe top it with a dollop of yogurt, and then you're getting your probiotics as well.
There you go.
There you go.
So we are all busy, right? And like I said, we are overwhelmed. So tell me how we can guide our patients because I know you have something for us.
Yeah, I think a well-stocked freezer and pantry are key. So don't be afraid of frozen fish, frozen chicken, frozen fruits and vegetables. Nutrient density is about equivalent to fresh. So I would say tell your patients they're convenient, they're inexpensive. Stock up that freezer. The pantry for sure. Stock up on things like your whole grains, your nuts, your seeds. Those are easy to incorporate or just throw over a salad. But one thing that I've really been into, and let's make it a thing, is naked meal prep. So if your patients have the capacity to meal prep, do naked meal prep. What I mean by this is Prep a bunch of, we'll call it brown rice as your carb, totally plain, seasonless. A bunch of roasted veggies, and then a protein, maybe salmon for the week or chicken for the week. Then it's super easy to go in and season it up. So Monday, maybe you're doing something with teriyaki. Tuesday, maybe you're doing lemon and garlic. Wednesday, you're doing something with marinara and grated cheese. So if you naked meal prep, it makes the whole week a lot easier rather than doing a whole bunch of, seasoning and making this gourmet meal on the weekends, which honestly can get expensive and frustrating and time consuming. And like, who can do that? Not many people can. I also want to encourage people to stop trying to be perfect. Sometimes we have to get something pre-made. So I just did a whole series on rotisserie chicken, which I find to be a very convenient pre-made item that just helps you get dinner on the table. And sometimes that's what you need to do. You need to get something semi pre-made and then put it into a meal that your family will just absolutely love.
Yeah, well said. All right, my final question to you. What does the future hold for you? Because you have a lot going on, and I can't wait to see what is coming up next.
Thank you. Yeah, so you can stay up to date with me at the Wellness Kitchenista. That's my social media. And there I share updates about live cooking classes. I do a lot of cooking classes. I collaborate with different organizations around the country to provide those and often will open up admission to the public. So definitely check out my social for all of that. And coming up this spring, I will be presenting at the American Academy of Physician Assistants, their annual conference. There is a really exciting cooking demo that we're doing, and I'm doing a few CME sessions as well there. And you can catch me at Scripps News. So I'm the food and wellness contributor for Scripps News, which is a national news network. You can also get the app on your smart TV. So I'll be there as well, delivering recipes. I'll have some really special guests joining me in the kitchen. So lots of exciting things going on in the future.
Jessica, you are so inspiring, and I am proud to call you a fellow PA colleague. I cannot wait to see what 2026 brings for you. And I hope we can continue the conversation because we have a lot more to cover about nutrition and skin disease and overall health. Thank you.
Thank you. And maybe we'll do a dermatology cooking session together. What do you think?
I love it.
Let's
All
do
right.
that.
We're already scheduling it as we speak. Thank you so
This was
much,
so
Jessica.
lovely. Thanks, Renata.